Hello, my name is Shakendria, and I'll be sharing my intervention presentation and reflecting on my capstone journey. I'll start by evaluating how my obesity intervention with my mother contributed to her health. Then I'll discuss my reflections on the capstone experience. I'll describe how I used evidence based literature in my project and assess how technology enhances its success. Additionally, I'll explain how policy considerations influence my project and whether the outcomes aligned with my predictions. Lastly, I'll reflect on my personal growth throughout the Capstone project and my RN to BSN program here at Capella. This is part one. For my capstone project, I interviewed my mother, Tijuana. She's a 53-year-old African American woman who has struggled with obesity throughout her adult life. She was a single mother of 3 children. She worked long hours, so she often neglected her self-care, which attribute to her obesity and also unhealthy eating habits, stress, and her demanding work schedule. My mother and I, we met a total of 4 times in the comfort of her home. We spent 2 to 3 hours each session discussing various aspects of obesity, including risk factors, community resources, and related policies. After presenting my intervention to Tijuana, my mother, I received valuable feedback. The intervention covered the causes of obesity, including social determinants of health, medications, illnesses, and dietary factors. We also addressed obesity-related health issues such as type 2 diabetes, cardiovascular disease, fatty liver, sleep apnea, kidney disease, gallstones, and obesity hypoventilation syndrome. Additionally, we explored phone applications for tracking food intake, calories, steps, and exercises, along with treatment plans encompassing medications, dietary adjustments, physical activity, surgical options, and sleep hygiene. We discussed strategies for managing obesity-related emergencies and provided a list of local organizations offering obesity programs. Tijuana expressed her commitment to applying the intervention to her daily life, particularly by downloading the MyFitnessPal app for meal planning, exercise tracking, and calorie counting. She emphasized the importance of monitoring her blood pressure regularly due to her history of hypertension and pledged to incorporate more fruits and vegetables into her diet. While she preferred the convenience of mobile apps over support groups, she indicated a willingness to attend programs if her work schedule permitted. When asked about the ease of incorporating the intervention into her routine, Tijuana found it straightforward, appreciating the self-directed task and the helpfulness of the emergency section for immediate medical guidance. She encountered no challenges with understanding the intervention and expressed intent to keep the brochure for future reference. I informed her about the app's features for tracking meals and weight loss progress, providing additional support for her wellness journey. Overall, she stated that she was satisfied with the information that was given to her to assist with her obesity. Part 2, Evidence and Peer-Reviewed Literature. Utilizing evidence and peer-reviewed literature was crucial for my capstone project, allowing me to incorporate credible evidence published within the last 5 years. I drew from a wide range of sources, including the Centers for Disease Control, also known as the CDC, the American Heart Association, the World Health Organization, and NIH. Additionally, I searched Google Scholar and Capella's library using key terms such as obesity, obesity complications, obesity risk factors to ensure credibility. I specifically selected websites ending in .org, .edu, and .net. According to Brunt, 2023, evidence based practice involves integrating the best available evidence with healthcare educators' expertise and clients' needs while considering the practice environment. This approach helped me ensure my capstone project incorporated up to date information aligned with current standards. Leveraging technology. Technology is revolutionizing healthcare, enhancing communication, patient satisfaction, and quality of care. In my capstone project, I utilized cell phones and mobile apps to monitor caloric intake, exercise, and calories burned, aimed to improve the outcome of obesity. According to Fawcett, 2020, wearable devices have long-term benefits for physical activity and weight loss, storing data on calories burned, distance walked, and heart rates. This information is valuable for discussions on interventions and progress with healthcare providers. Patient portals are also increasingly popular, enabling patients to communicate about medical issues, request prescription refills, access appointment details, and view recent lab results, fostering better patient provided interaction. Health policy. The Affordable Care Act, also known as ACA, influenced the planning and implementation of my capstone project for my mother, ensuring that the majority of treatment options were either free or affordable. The Affordable Care Act allows all individuals access to health insurance regardless of comorbidities, race, ethnicity, and culture. This access to healthcare is particularly crucial for individuals with limited financial resources, relieving them of the burden of medical expenses associated with obesity treatment. Campbell 2020 reinforces that the ACA designates funding for community health centers in underserved regions. These centers play a vital role in supporting individuals struggling with obesity, likely offering access to care coordinators who can aid in interventions and goal setting to address obesity related issues. The baccalaureate prepared nurse play a significant role in policy development and implementation due to their education and training. With their ability to analyze data, comprehend complex issues, and propose evidence based solutions, these nurses are well equipped to drive changes in healthcare policies. They serve as advocates for patients and communities, ensuring that policies are fair and effective. Collaborating with interdisciplinary teams, they assess policy outcomes and make necessary modifications. The baccalaureate nurses have the capacity to influence policy development and implementation at various legislative levels, advocating for the well being of communities, families, and individuals. Outcome and prediction. Yes, I believe the outcome of the Capstone project aligned with my predictions. The project essentially encapsulates the daily work of nurses in a written format. From the moment we first assess a patient to their discharge, we employ best practices to understand the core of their issues by asking pertinent questions about social determinants, demographics, culture, diet, and recent weight loss or weight gain, all while building rapport with the patient to educate them on potential solutions. In Tawana's case, as she combats with obesity, It was my responsibility to offer her evidence based interventions to help manage her condition. She was receptive to these interventions and agreed to incorporate some into her daily life. Given the effectiveness of my intervention and its foundation in best practices, I believe it can be applied by anyone dealing with obesity. My personal growth. Continued education is essential for nurses to keep pace with the evolving healthcare landscape. For years, I had been eager to pursue my BSN, but struggled to find a program that could accommodate my busy schedule as a full time working mom. Capella University provided me with the flexibility and skills needed to advance my career. While writing research papers was not my forte, my confidence in both writing and research has grown significantly since attending Capella. The Capstone experience was the highlight of my journey, as it has equipped me to tackle any academic task, be it paper, PowerPoint presentation, or brochure. I wholeheartedly recommend this program to my fellow nurses. This has been a great experience for me, a huge learning experience, a learning curve, but I conquered it. And I just want to thank all the instructors. Thank you guys for what you do. You all have been amazing, and I appreciate you all. I wish you all well. Thank you so much. I'm over and out.